Hello and welcome to Spine Time. My name is Roger Härtl and I'm your host today. I'm the Director of Neurosurgical Spine Surgery at Weill Cornell Medical College in New York, and I'm the Director of the Cornell Center for Comprehensive Spine Care here in New York. It's my great pleasure to host today's webinar on sport and spine, how your fitness routine affects your back. We've got two great guests here. And we're going to talk about everything that you ever wanted to know about spine and how that affects your or sport and how that affects your spinal health. As you know, at the Spine Center, we put great emphasis on interdisciplinary care of our patients. That means not only do we have surgeons here, neurosurgeons and orthopedic surgeons, but we work with pain management, rehabilitation medicine, physiatry, complementary medicine. We have neurology here. And the goal is really to put everything together to diagnose your spine problem and to lead you down the path to a successful and long-lasting treatment success. And we know that along this path, sports or exercises and any type of rehabilitation are incredibly important before, during, and also after treatment sometimes. And that's what we want to talk about. Now we have two guests here today. Dr. Jennifer Soo Hoo, who is an assistant professor of clinical rehabilitation medicine at Weill Cornell Medicine here in New York. And it's a great pleasure to have Dr. Rob Stefano here. He's the team chiropractor of the New York Giants football team. And he's the co-author of a New York Times bestseller on muscle medicine. Thank you, Rob. Thank you, Jennifer, for joining us here today. And they'll get a chance to talk a little bit more about their own career path and how they got involved with sports and spine. I want to get it started. As always, I like to give you a little bit of a historical background, a little teaser. If you talk about spine, especially if you talk about spine, back pain, and spine surgery in sports, one name comes up, and that is Hans Kraus, who was an orthopedic surgeon here in New York, in the city actually, who practiced in the 1940s, initially at Columbia and then Atlantic Cell. And he was originally trained as an orthopedic spine surgeon, but quickly realized that a lot of what he dealt with were sports-related injuries, and he was a climber and skier. He treated a lot of athletes, and he realized that a lot of these athletes who had injuries did not necessarily need surgery, but were really treated very, very well with exercise, by strengthening the muscles, by strengthening the tendons. And he integrated that into his practice very successfully, to the point where he was really one of the leading doctors who treated, for example, JFK, who, as you probably know, suffered from tremendous back issues, had multiple back surgeries, and never really recovered from his back issues until he started regular exercises, focusing on a daily exercise regime under Hans Kraus. That was an incredible success story early on. And he used, for example, in his practice, on every patient who would come into his practice complaining of back and neck pain, he would have them undergo some simple tests to figure out their strength level, because he could figure out that that was directly related to their likelihood of really coming out of back pain and undergoing successful treatment for back issues. So based on their muscle fitness and their muscle strength. He published a paper in the 1980s where they treated patients at the 92nd Y, and they treated patients with back and neck issues with exercises, and they found that 80% of patients experienced a significant reduction or elimination of their back pain if they underwent regular exercises on a daily basis. And even patients who had failed back surgery, 80% of those patients did much better just with exercise alone, the right exercise at the right time with the right instruction. And I think that was a nice kind of background to really get the conversation started. And I would like to ask Jennifer maybe to get started, and she's going to talk to us a little bit more about the role of the discs and the bones in spine health. And then Dr. Stefano is going to talk a little bit more about the role of muscles and how that relates to spine and sports-related injuries. So thank you, Jennifer.
All right. Thank you, Dr. Härtl, for that introduction, and thank you so much for inviting me to speak today. Hi, everyone. As Dr. Härtl said, my name is Dr. Jennifer Soo Hoo, and I'm one of the sports medicine physicians here at Weill Cornell. I also serve as the Associate Sports Fellowship Director for our Sports Fellowship program here, and I also do some traveling with U.S. Soccer to help cover some of the youth women's national teams, as well as the U.S. Paralympic team. This topic we'll be addressing today is a big one and something that is definitely relevant to my practice, especially in the last several months. As everyone knows, exercise can provide numerous health benefits to the mind and body. The American College of Sports Medicine is known as the gold standard for exercise recommendations, and as you can see here, they recommend a minimum of 150 minutes of moderate intensity of exercise per week, in addition to 2 times per week of muscle strengthening activities that involve all parts of the body. Since March, with the onset of a pandemic and gyms and classes closing around the country, this has made reaching this benchmark a lot harder for everyone. Closure of these types of classes had everyone, including me, scrambling to figure out how they were best going to get their workouts and exercise in. As people have been doing a lot more home workouts, a lot more biking, Peloton has become really huge now. I've seen a lot more people come into me and ask why all of a sudden they're seeing an increase in their low back pain. Can you click to the next slide? A typical situation I see is a patient in their 30s or 40s who's always been really active that are coming in for evaluation of a new low back pain flare. Typically, they say their day looks like this cartoon shows, where they spend the majority of their day working from home, sitting at their computer, and then taking a break, either going for a bike ride, doing a home workout program, and then coming back and either, continuing and finishing off their workday or spending some time in front of the computer, interacting with friends, family via Zoom. They typically start to notice that their back starts to feel stiff for the first couple of weeks before starting to get progressively worse pain. Usually then they describe they have pain more with sitting for long periods of time, driving, and then it improves with standing and moving around. This type of pain that I'm describing is something that I see really commonly in clinic and is usually coming from their lumbar disc. And if you move to the next slide here. So this is a really great slide and is a figure that I show all of my patients who come in with this type of issue. It's based off of a research study that shows how much pressure is going through the disc when doing certain positions or activities. The bars that are marked in red are the activities that put the highest amount of pressure on the disc of your back and could put you in a more vulnerable state for back pain or injury. As you can see, this top graph here in the middle is sitting with poor posture. That's basically all of us every day, especially now working from home. We have a lot more poor ergonomic homework setups rather than when we're in the office. This could be sitting on the couch texting, playing video games. This could be, taking longer drives, sitting on the subway, all of those things. We spend a lot of time in that posture. Number 2, that box on the left is bending forward with weight in your hand. So that looks like a deadlift, which certainly it can be, but can also be something like picking up your kids, moving boxes, things like that. And then the third box on the right-hand part of your screen are sit-ups. And so I have a lot of people say, hey, wait a second, I thought core exercises were actually better for your back. Why are sit-ups bad for you? And you're right, core exercises are important and can be really helpful for your back pain, but it's about choosing the right core exercise depending on the person. So sit-ups can be really good for your core, but can put a little bit more pressure on the disc of your spine and can flare up back pain. So if you are someone who are dealing a little bit more with low back pain, maybe a more neutral-based exercise such as plank, side planks, those types of things may be a better fit for you. What I really want to iterate here, though, is I'm not saying you cannot do any of these activities. These are part of normal daily life and exercise and all of those things, but more that I want you to keep in mind how much of the day you're spending in these activities. It's usually a cumulative stress on the disc that leads to these types of pain or injury. So right now, with people not moving around, they're just sitting at home, so they're spending all of their time in that middle box position, and then the rest of the time they're maybe doing workouts, which they're doing either 2 or 3, and that's a lot of time where you're putting a lot of pressure on your discs of your back, whereas you may have taken breaks before with like commuting, walking, going hanging out with friends. You relieve the stress on your back when you do those things. Meanwhile, right now when we're just sitting at home, you're putting a lot more stress, and that's why I'm seeing a lot more of these types of issues. If you click the next slide here. So this is just driving this point home. This is just showing what happens when you stay in a more lumbar flex position. As you can see here, you're putting more pressure on the anterior portion of the disc, which is driving force and pressure backwards, which is causing that disc wanting to feel like it wants to either herniate or bulge out more and can lead to pain and discomfort. I'll talk a little bit more specifically about HIIT workouts and recommendations for like spinning and those things a little bit later, but I'll pass it on to Rob next.
So Jennifer, real quick, I just want to mention for the audience, if you want to submit questions, there's a chat box. Don't be shy, just write your questions. I'll try to pick those up and relate them to the speakers. So next we have Rob Stefano. Rob, thanks again for being here. You want to say a few words about your day job and what's going on with the Giants right now?
Sure. This is my 35th year in practice, and I've been with the Giants. This is my 19th season. So I'm at the facility treating the athletes a couple days a week, and then on game day. And when I'm not doing that, I have two offices between New Jersey and New York that I run back and forth and take care of patients there too. Thanks for having me, Roger. I appreciate it. And appreciate everyone tuning in to listen. So with some of the slides that I chose, what I decided to talk about in relationship to home exercise or exercise you might be fortunate enough to do at the gym right now before we get shut down again. Fingers crossed that we won't. That I decided to go on a more muscular standpoint and show how some of these activities, excuse me, can cause muscular dysfunction and how those dysfunctions within the spine and the musculature around it can cause referred pain. So the first slide that you see here is the scalene muscles. And I didn't want to talk about the spine just from the waist down. I chose this slide and this set of muscles because there's a thing that I've been talking about called Corona neck. Everybody's sitting at home looking at the computer. And the problem is a lot of people are on laptops because they thought it would be temporary. But now, 9 months later or however long it's been, we're still at home. So the simple solution for that is raise your laptop up at eye level and get an external keyboard and mouse. So you're not looking down, contracting the scalenes, because these scalene muscles, when they get very tight, you can see on the right-hand side of the slide, it refers pain that is very similar to a C5, C6 disc. And very often people think it's a disc-related condition, but it could be the anterior musculature of the neck. Also, when you're spinning and you're looking up at a screen, while you're flexed forward and you're looking up, you're also really straining these muscles. And any of the HIIT type exercises that you do, Olympic lifts, deadlifts, squats, they can also really strain these scalene muscles. I wanted to just briefly talk about the pros and the cons. Those are the cons, but the pros are the exercise you're doing, such as deadlift or weightlifting or spinning. If you have your head in the right position, can also strengthen these muscles and help you feel a little bit stronger and more durable when you're sitting at your computer.
Rob, real quick, do you think if somebody has that, what you describe here, the pain shooting down your arm, is that because the nerves are being compressed as they travel through those muscles, or is that something else?
Yes. If you look at this slide on the left side of the screen, you'll see the nerve roots exit between the anterior and middle portion of the scalenes. And the first two parts of the scalenes elevate the first rib and clavicle, and the posterior scalene goes back and attaches to the second rib. There's a lot of things they do, including flexing the neck, but they also help with respiration. So when you're breathing really hard and you're exercising hard, you can also involve these muscles, and they can entrap that nerve root that goes down in the arm and can recreate that numbness or tingling or pain that you get in the shoulder blade and down your arm.
Interesting.
And those pictures are taken out of Janet Travell's myofascial pain and dysfunction. So the next slide, we move down, which is, I think, if I were to say one muscle in the body should be treated, it would be the psoas, because the iliopsoas combines the psoas muscle, which attaches to the 12th lumbar vertebra, 12th thoracic vertebra, all the way through the lumbar, and then the lesser trochanter of the hip. And it combines with the iliacus to form the most powerful and primary hip flexor of the lower extremity. And when you're cycling and you bend forward, not only are you flexed, but you're also really pumping that psoas. When that muscle gets tight, that can also refer pain into the back and into the groin. And sometimes it can even trap some of the nerves like the femoral nerve and cause some numbness as well. So the pros to cycling and HIIT workouts are strengthening this muscle. But the cons are if you go too heavy in weightlifting or you're cycling too frequently without stretching this muscle, you can really have tight hip flexors, which can cause some lower back pain. Let's see, the next slide. I chose the quadratus lumborum, and the QL, which is how it's affectionately known, is a really interesting muscle because it has fibers that go in two different directions. The anterior fibers that attach from the ribs to the transverse process do a different function than the muscles that attach from the ribs down to the crest of the ilium and from the ilium up to the spine. So it's a postural muscle that stabilizes, but also does flexion, extension, lateral bending. And this muscle gets really stressed during cycling and lifting as well. But if you strengthen this muscle, it really helps the posture of the spine and can help eliminate some of the pains. On the right, you'll see the referral pattern. And again, it refers similar to some of the upper lumbar discs, but it can, a lot of times it can be mistaken for a disc-related issue, and it could be muscular.
You know, Rob, this is really fascinating because these muscles all have, particular function, of course. And that's, speaking as a surgeon now, as a surgeon who does a lot of minimally invasive surgery, the whole point for us is to protect those muscles, because with traditional surgery, you would remove a lot of those muscles in order to get down to the spine. But you're pointing out so nicely that these muscles actually really have an important function. And therefore, if, nobody wants surgery, but if you need surgery, you should really try to protect those muscles.
Yeah. And you do a great job at that. The next slide is the erector spinae, and it's not one muscle. There's a lot, as you can see in the slide, there's a lot of dimensions to this muscle. It's really a complex group of muscles that start in the lumbar spine and work there and traverse the way all the way up. And there's three portions of it: the spinalis portion, the longissimus, and the iliocostalis. And these muscles are stabilizing muscles. They help the spine extend, laterally bend. They help rotate. They do a lot, and they're the antagonist of the psoas. So if your psoas is super tight, these muscles have to contract twice as hard to fight a tight psoas. And that's why you'll get a spasm or tightness in the lower back, particularly if you're sitting slumped forward, like Jennifer pointed out. If you have poor posture, not only will these muscles be stretched to an uncomfortable level, but the psoas is going to be contracted. So they're in a tug of war with each other, and they're really fighting each other, and working on strengthening both sides and keeping them loose is really important. And the referral pattern on the right is only one portion, really, the iliocostalis portion. If you go through each portion, I would have had to have 6 or 7 slides to show where each one of these erector spinae muscles refer. So the slide on the right with the referral pattern is really just a generalized view of where they can refer pain to.
Interesting.
So this is just some tips I threw in, very generalized. Consistency is the key. It's better for you to do small amounts of exercise more frequent than to do a lot of exercise in one day. The problem with weekend warriors are they'll do 2-3 hours of exercise 2 days a week and then nothing during the week. And it's better for you to do 20 minutes a day is better than one day for an hour. And you want to cross train, spinning 7 days a week. I love spinning. I'm a cyclist myself, but spinning 7 days a week is probably not as good as spinning alternate days and throwing in some elliptical or other type of cardio. And when you're lifting, unless you're trying out for an Olympic team or a professional athlete, don't go too heavy. We're beyond the point of trying to impress anyone. And make sure you're hydrating. And it's better to do active stretch versus static.
Yeah, that's a good point. I was going to. There was a question from the audience about you're a chiropractor. Can you
Correct.
just how does that different from somebody who does other types of interventions? But because sometimes people think as a chiropractor there's a lot of manipulation, and therefore there could also be some risk to the spine.
Sure.
Can you just explain that, because I think there's a little bit of misconception sometimes as to what a
Sure.
chiropractor really does.
Yeah, I'm happy to. Just like in every profession, and even within your own, there's different approaches towards the same problem. And chiropractic typically and traditionally works on looking at the spine from a standpoint of dysfunction. Where is an area of a spine that's not moving properly? And what traditional chiropractors do is they'll find that area of restriction, and they'll put a force in a high velocity, low force energy to help mobilize that spine. And that pop you hear is merely just the separation of the joint surface, like a suction, which allows fluid to go between the joint and a better mobility and gliding. But within my practice, I emphasize, and I found same as the person you introduced as Krauss, I found more of the problems people suffer from are muscular and not really just spine dysfunction, but the way the spine is being influenced by muscle. So if you fix the muscle, a lot of times there's no need to have to be aggressive with spinal manipulation, or even in your case with surgery. If you get the muscles right, the spine functions properly and will be in a good position.
That's really good, and it totally makes sense. What you described here is that you should really mix it up. You shouldn't do one thing all the time, but you should mix it up. Can you quickly, just for everybody to understand, the difference between active stretch and static? What does that mean, and why is one better than the other?
So a static stretch is, if I was stretching my arm, I would stretch it out and I would hold it for a period of time up to 20 seconds or so. And an active stretch is stretch all the way to the end range and then release it. I like active stretch for a static as a general rule. Static stretch is really good for two reasons. If you're a figure skater, a kung fu master, or you need a lot of flexibility, then static stretch can help. But for the general athlete, active stretch is better. And the other way static stretch is good is post-surgically. If we really want to stretch that scar tissue out in that joint and hold it to help prevent scar tissue, that's good. But for a general rule, if you're an everyday athlete, recreational athlete, active stretch is a good way. There's some research if you want to do for active isolated stretch developed by the Whartons. They have a really good methodology of stretching.
Interesting. All right, so we'll move on, and we'll talk a little bit about the actual exercises that you can do for those of us who have back issues. Jennifer, do you want to? What's out there? What has been proven to really work in patients with back issues?
Well, that's a good question. So, I don't like to restrict people from what they love to do. I usually like to ask patients, hey, what are the things that you usually would love to do aerobic wise, and then kind of walk through some of those different exercises that may be causing them more pain and talk about modifying them. For example, right now, HIIT workouts, so any of the home workout programs, you can do a lot of these different apps and doing these things. Low back pain, as research has shown, is one of the more common complaints. However, people really love doing this. They really get their heart rate going. It's a really good whole body exercise, and it can be really, healthy to do, but you want to keep certain things in mind You always want to make sure you do a good warm up before you start the workout. So for right now, you don't want to go straight from, sitting at your computer to going and do a bunch of deadlifts and a bunch of squats.
Can I ask you
wanna,
real quick, just tell it, what does that mean, HIIT workout? I mean, what is that, running or weightlifting, or just from the practical?
Yep. So HIIT is also called high intensity interval training. And so the basic premise, and you see a lot of these workouts like CrossFit, Orange Theory, those are all examples of classes that try to attack these HIIT workouts. But you can also see all of these YouTube videos for HIIT. They're just like short periods of a workout where you get your heart rate up, and then it also combines with strength and power. So you can, like Orange Theory, you do a lot of running combined with rowing and body exercises to kind of help reach this. And then kind of kept going back through my recommendations. If you're a beginner and you've never tried a HIIT workout or a CrossFit class, data shows that you should consider a class that have a required training period or have close coach supervision to make sure that you're doing things correctly. I really want to emphasize having proper technique. Some of these classes, especially as you get going, they have a lot of competitions on who can do the most reps in a minute, the highest weight in a minute. And I have a lot of people run into issues when they don't really focus on the technique and they really just try to win the competition. And then you just need one bad repetition to really have bad posture doing a rep, and that kind of causes issues. When you want to increase weights, I recommend you do them slowly. If you go on vacation for 2 weeks, you don't want to come back and go right back to the weight that you last did. You want to start a little bit lower and then slowly increase them again. And then I would recommend, having at least 1 to 2 rest days per week. You need time for your body and your muscles to recover, to be strengthened, so you have the endurance to continue doing these workouts. I think my next slide here just was hitting that point home about good posture. The guy on the left is good doing an exercise in good posture, and the guy on the right is doing an exercise in poor posture. And you usually see that in people who are trying to really up their weights, and so they need to flex their spine to really try to get that to do the weight, and that's not a good thing and a recipe for having more pain. I have slides on spinning, but I don't know if you wanted.
In general, this wouldn't be, I mean, for the most part, neither one, even if you do it in a good posture, these are not good exercises for patients with back issues, correct? Probably.
Yes. So, yes. I mean, I have a lot of people who like swear by these and just want to keep doing these. But yes, if you do these a lot, it can cause you continued intermittent flares of back pain, and something not recommended if you are constantly dealing with back pain.
Sure.
And then I guess going into spinning and cycling. So again, research shows low back pain is the #1 most common complaint with this. Recommendation to really focus on bike fit. The slide after that will show this a little bit better. So making sure you're a few minutes before you start this, making sure your seat height is correct, saddle angle, looking at handlebar position. Some people ask about like the arrow position. Those are usually, I recommend, more experts who have maybe the core strength and endurance to stay in this position well. You want to make sure you maintain good posture throughout the entire bike ride. So if someone you're riding with, or you notice you're starting to flex forwards, that means that you're fatiguing and your muscles are fatiguing, and you should probably take a break or cut the bike ride off then. And then, as Rob mentioned earlier, you want to cross train. So you want to incorporate core and lumbar stabilization exercises as part of your general workout routine, so you can have the endurance to be able to bike longer. And then if you are someone who continually has flares of low back pain, you really want to consider decreasing the time you spend on the bike. There's one study that showed that those who cycle greater than 160 kilometers per week were 3.6 times as likely to experience low back pain than those who cycled less. So something to consider if you're constantly dealing with low back pain. And then my last slide here.
Let me ask you a quick question, maybe also to Rob. there was a question from the audience that's really good, and I hear that all the time from patients. Let's say somebody does the cycling, the spinning, and they experience back pain. Should that be a warning sign for them to stop, or should they push themselves? What is your recommendation in patients who do this, or they walk, they get pain? Should they push themselves, or should they just listen to the pain and stop doing what they're doing?
Jennifer, you want to go first?
Sure. I think that's a good question. I think it really depends on kind of like the type of back pain. Sometimes, if it's like a little bit of soreness, that's probably just a little bit of a warning sign that maybe you're starting to fatigue. And I would recommend, getting off, the bike, stretching out. Maybe that's your limit for the length of time you're on that bike, but doesn't mean that you have to stop biking, but it just, is the warning sign that, hey, you're starting to fatigue, you may want to consider strengthening before you're trying to increase the amount of time. If you get like a lot of really sharp pain, really bad muscle spasms, then that's a little bit different, and you want to maybe take a little bit of break, maybe get it looked at, and make sure that you're doing things correctly, because I think the thing that I see the most often is that the bike fit is the biggest thing here. And if you see someone who can fit it correctly for you, a lot of physical therapists can also run through that with you. That can be quite helpful.
That's a good point.
Yeah, that's a great point. The bike, that's the first thing I was going to say too, is the bike fit. I mean, very often it's the seat's too high or too low. If it's too low, it's going to overstress the quads. And if it's too high, you're going to rock your pelvis. So the general rule, standing next to the bike with it at hip height is good, but some people have disproportionately long femur lengths or tibia lengths, so it doesn't always work. So a good rule of thumb is when your foot is down at the 6 o'clock position. So 1 foot down all the way down with it flat, your knee should be bent at about 15 degrees, which is probably about the right spot. The other thing I tell patients too is if you're cycling or you're doing any activity and the pain is dull in the beginning but eases up as you go, that's usually a good sign it's muscular. And once the blood flow gets in and the muscle gets warmed up, you're okay. So getting it treated or a good stretch routine could help. But if you start exercise and it's painful and it gets worse as you go, then that exercise is probably not the right exercise for you, or it could be something more involved, and you should have that checked.
So you really got to listen to your body and really, take it very seriously. But if it gets better over time, then it's probably more muscular, and you're probably okay. If not, then you got to be a little bit more careful.
Yeah, and there's not an easy answer, because sometimes you can push through pain, and the pain might just be that you're not in shape for the activity you're doing, and other times pretty much if it's a serious condition and it really hurts, it'll let you know, and you really need to listen.
Great. I think, Jennifer, you had a few more comments about the picture. That was or did Rob cover that pretty much?
Rob mentioned that this is just kind of a visual. It's a good starting place, as Rob says. If your torso or your legs tend to be longer, this picture, which kind of shows you how things should be aligned, may not be the exact fit. So you want to take a look at it, but this is a really good starting place of what your position should look like when you're on, right now, more frequently a spinning bike, but also on a cycling bike.
I have a question about this picture in terms of the posture, the back. She's kind of leaning forward. I usually tell patients to try to keep, try cycling, but try to get on a recumbent bike where your back is really straight. Do you think that is? Do you think for patients with a back issue that this position would be okay, or do you think a recumbent bike would be better?
Yeah, good point. So for people who kind of have chronic back pain issues or very frequent flare-ups, I do recommend a recumbent bike because it does put less pressure on the spine. Being in this position here, if you have your core engaged and your pelvis isn't too posteriorly tilted or anything like that, that can be okay. However, it's really easy in this position to have a flex spine, which is that when you start running a little bit more into trouble. So it's much easier to have tell people to, hey, either raise the handlebars up so you're not so far flex forward, or tilt the saddle down so it's a little bit easier to stay more tilted up, or get a recumbent bike.
Got it. What's a good warm-up exercise? There were some questions because that came up earlier. What's a good exercise for if you get started with your exercises, maybe the warm-up? What do you recommend?
I think it's a little bit different depending on whatever exercise you're trying to do. You always want to start slow. So either, walk. So doing start with a quick walk and slowly getting your heart rate up. Don't go straight to a sprint or things like that. For weightlifting exercises, I usually like to tell people to start a little bit lighter to get their, the blood pumping through all their muscles and things like that before you start trying to really get going with either heavier weights or faster reps. That's usually a good place to start. Most classes should have a warm-up period where they take you through a warm-up, and it's usually a more dynamic, active warm-up that Rob mentioned with some more active stretching rather than static stretching. Usually you anywhere between 5 minutes, sometimes more if you have more pain can be helpful.
Yeah, that's a great point, Jennifer. I tell everyone the same thing. Whatever sport you're doing, just do that sport at a much lower intense level, like walk before you run, spin really easy before you start going hard. Some spin classes I've been to, they have like a 5-minute or a 2-minute warm up and they jump right into it. I mean, you should try to warm up for at least 10 minutes. I tell everyone a good 10-minute walk before you start running is really, and I got that from an Olympic athlete, by the way. It wasn't a recreational athlete.
Interesting. Now, there's something about the psoas. A lot of questions about the psoas muscle, Rob. You pointed out that psoas muscle is one of the biggest muscles. It's so important for patients with back issues, and having been through a treatment with you, I know that getting down to the psoas muscle is quite an experience as a patient, and that was exactly a question here. How do you get to the psoas muscle, and then what about massage? Maybe we can talk about that a little bit, but maybe talk about the psoas muscle and how you treat that and how you get to that muscle.
Yeah, the psoas is a very deep muscle, so it's in the front of the spine. So the only way to get at it really is to palpate through the large intestine, and you're compressing abdominal contents down onto the psoas. So you can never really get directly onto it. You're kind of pressing through abdominal musculature, abdominal contents, and then compressing. I'm a big fan of what's called pinning and stretching a muscle. So the concept of pinning and stretching a muscle is rather than just massaging over it or trying to stretch it, you actually shorten the muscle, pin it down, and then lengthen it. And what that does is helps break up fibrous adhesions within the muscle or between myofascial planes. So a lot of massage therapists will get at the psoas with you on your back, bending up your knee to shorten it, and then getting in deep in your abdominal cavity and doing massage. Or a pin and stretch would be bending the knee, compressing the psoas, and then lengthening the leg, bringing the knee down, which lengthens the psoas. And that pin and stretch of that psoas is really effective at eliminating back pain that's caused by the psoas. The truth is there's really not a great way to stretch it, and there's really not a great way to do self-treatment on it. It's one of those muscles that you do have to kind of rely on a therapist. In the book that I wrote that you mentioned before, there's a lot of self-treatment of muscle, and we don't talk about the psoas because I don't think it's a wise idea for the general public to be compressing their large intestine unless they have someone to guide them through it.
Right.
But it's a difficult muscle to stretch too. If you go on YouTube, there's some decent stretches for psoas and some variations on it, but it's a muscle that can cause a lot of problems.
I got it. I don't want to finish up before talking about some specific sports that people really like to do and that sometimes can cause back problems. And a lot of patients want to go back to those sports, of course, once they recovered and healed up. Really quick, maybe Pilates and yoga. Maybe Jennifer, do you want to say a few words about the difference and what are the pros and cons?
Yeah, so I mean, right now, because there's so many different versions of Pilates and yoga, sometimes they can look very overlapped. I think historically, yoga has been more of like a mind body, more about stretching, meditation, that type of thing. However, there are a lot of yoga classes now that look, have a lot more kind of strengthening and other components involved, which look a little bit more like what Pilates looks like now. And so I think they're very similar. They can be really great, especially because they do a lot of more body weight exercises rather than a lot of lifting big dumbbells and things like that. And so they really focus on certain on your glutes, on your core, and things like that. And so that can be really helpful for you. However, some of the more advanced classes, when you get to like aero yoga and things like that, then you start really working your spine and putting more pressure through things, and then those can put you a little bit more in danger.
Was Pilates developed with spine issues in mind? Is that true? Was it originally developed for patients who had back issues?
Yep. Do you want to take that, Jennifer?
Go ahead.
Pilates was really geared a lot towards dancers and transverse abdominis and strengthening the core. And it really does an effective job at strengthening. I think what Jennifer was saying before is very wise, is there's a lot of modified classes out there that don't really hold true to the original philosophies. And Pilates is really best done by a certified Pilates instructor who can really walk you through the steps and is very mindful of your body position. I wouldn't recommend starting Pilates on your own without an instructor and just trying to recreate some of the exercises, because, they can be more harmful than helpful if you're not doing them correctly.
Got it. Now, I just want to finish up with golf. I think 95% of my patients, they ask me always the same question: when can I go back to playing golf? And I have my own opinion about that, but I want to ask you guys, what do you tell your patients? What are the risks of golf in relationship to back and neck issues? And after, if somebody has had back issues, maybe they had surgery, what do you tell them about returning to golf?
Do you want to go first?
Yeah, maybe Rob, go ahead. Yeah.
So I tell people who want to return back to golf to just buy a dozen cheap golf balls and go throw them in the lake and go home, because that's where they're going to wind up. No, I'm kidding. I golf myself, and it's a lot of torque on the body. The biggest problem in golf is the deacceleration phase. You're swinging a club head anywhere between 75 and 100 miles an hour, and then has to come to an abrupt stop. So especially no matter how easy people try to swing a golf club, you're always swinging harder than you think. So you really have to, particularly if you've had back-related surgery or you have back-related injuries, you really have to make sure your core and your back is strong, particularly the deep intrinsic muscles, multifidi, the erector spinae that we showed, the QL and the psoas. If you have those muscles strong and they're stable, and you start off really warming up properly, I think you can golf effectively, pain-free. But the problem is people try to return too quickly, or they try to overswing, or they aren't strong enough, and they're trying to play outside of what their fitness level is.
Yeah, I mean, we see that with surgery. Certainly, afterwards, I tell patients to hold off at least 6 months, 4 to 6 months, and then maybe slowly go back, because because exactly the deceleration and just the mechanical impact, especially on the lower lumbar spine, is incredibly risky, and especially in patients who had herniated discs, and also for the cervical spine probably. Jennifer, last question. HIIT exercises. I think there's a lot of science behind this, but if somebody really wants to take up and doing that, what's a good recommendation for those who want to do this? Do they take classes, or do they get a personal trainer? Can they do that alone? Video classes. What's a good way to do that?
Yeah, that's a good question. So a little bit harder because right now with the pandemic, classes are really not happening. Ideally, I would recommend, if you've never done any of this type of exercise before, I would recommend either starting either with a personal trainer or a physical therapist to help kind of take you through some of those motions to make sure you're doing things correctly. And then when you start a class, you really want to get a beginner class where the coach is really coming around and making sure you're doing things properly, because proper technique is huge here. And so, when we're all young and we don't and we have no pain, our body can easily do lots of things wrong and feel no pain. However, as we all get older and things like that, our body can't handle that as well. And so, especially right now with HIIT being so popular, I've seen a lot of people who are just starting out, just trying to kind of get right into it and having a lot of issues. So I really think having that oversight is really important.
Good point. Yeah. Okay, I think we're gonna leave it at that. I had one slide that I wanted to show. Is kind of my favorite slide, which I think summarizes what we talked about, and that looks at the intensity of activity in relationship to the risk of back pain. And I think it's the middle. You always want to reach the middle. If you don't do any exercises, you're in trouble. If you do too much, you may hurt yourself. So try to do something every day, and take into consideration the wise recommendations and the advice that we got from Jennifer and Rob today here. And obviously, if you need more, just come to the Spine Center, and we'll be happy to give you more advice. Jennifer, Rob, thanks for spending time. Thanks for being here. And everybody at home, thanks for calling in. We'll have another Spine Time webinar in about 2 weeks. I think that's about scoliosis. And if you have any recommendations what to talk about, please let us know. Thanks, Roseanne, Tatiana, and everybody who put this together. And have a nice evening.
Thank you, Roger.
Sure.
Thank you.
Bye-bye, guys.